So if a patient goes to you and they're currently wearing a denture, what are their options when it comes to dental implants in your practice?
Well, there's a lot of options.
Okay.
So, the hardest part about denture wearers is getting in to come see me because they don't go to the dentist anymore. They got dentures 5, 10, 15 years ago, longer perhaps, and they don't see the need to go to a dentist. They're not happy with what they've got, but they think that's the only thing they can do. So option number one would be you come in and get just a couple implants on the lower. So typically the lower is the one that's not going to fit quite as well. You're wearing a lot of adhesive, it's flopping around, you can't eat what you want, and those 2 implants will help stabilize that.
So it's a snap in, snap out set of teeth.
Snap in, snap out, just like a snap on like your jacket or something like that. Very, very similar concept.
No adhesive on that?
No adhesive. So, and that's a nice starter step, right? That's, pretty low, it's budget friendly, and that can really improve someone's health and overall well-being, just those 2 simple implants. And then from there, sometimes we'll step it up and we'll do 4. So just like a chair on a table, it's more stable when you have 4. So it prevents it from rocking back and forth.
So 4 implants.
Yep, 2 in the back, 2 in the front.
A full set of teeth.
Yep. Snaps in just the same, but it keeps it from rocking front and to back and side to side.
What could they eat with that?
You can eat almost anything with that. So, that's coming from a denture to have those 4 implants is literally life-changing. That is a huge, huge difference of not having to come in and out, flop around, not really having to worry about them near as much. And on the top, a lot of denture wearers would know, it covers the roof of your mouth. And when it covers the roof of the mouth, that gags you. You can't eat, you can't taste things near as well. And so when you do the 4 implants on the top, you can make that into more of a horseshoe, which is huge difference from what it is when you have a regular denture.
Like spices or hot and cold things or whatever.
That's what a lot of people that go into dentures don't realize. It affects the way you taste things. You wouldn't think that, but yeah, the roof of your mouth really helps you taste your food.
Okay. So what's the next level up?
So the next level up is what I love to do, and that's when you do a fixed set of teeth on 4 to 6 implants. And so you come in, and that same day you would have teeth fixed permanently in your mouth, and you would walk out. Even so, for someone who's been wearing dentures for 15 years, they can come in the same day and have teeth that are fixed like they were 18 again.
Now you mentioned somebody wearing a denture for 15 years, but you don't have enough bone if you've been in a denture that long.
So that's a common misconception.
So it's not true anymore.
That's not true anymore. So I do a lot of complex implants, sometimes that are necessary for someone who has a lot of bone loss. But I almost guarantee there's enough bone to work with. So I get a lot of patients say, oh, I think I might be too far gone. Or they've been told by another dentist that you don't have enough bone. I have it all the time. And I know that that is not true because I do the implants and they work beautifully.
So you have like special implants for people with limited bone?
Yes, exactly. So it may not be your normal implants, but it's a little bit different of an implant, but it's not anything that's crazy. It's not anything that's going to cause any more trauma or anything like that. And they work beautifully and they're long term.
How old can you be to get, how old can a denture wearer be to get this procedure?
As old as they want to be. So I did the patient that was 93 last week.
Why would a 93-year-old want to do this?
Well, so the way I explain it is, so they may be on their later stages of their life, and so, they're alive, but are they living? And those are 2 different things. Are they enjoying their life? And so they'll ask me that and say, I don't know if it's worth it. And I say, well, is it worth it to eat how you want for the rest of your life? Well, when you put it that way, it's a little bit different, So yeah, it is to me, it's a personal decision.
I guess if you're lucky enough to be 80, 90,
yeah,
food is a big deal.
Yeah, well, don't
big
you
deal
want
for everybody, but especially.
Don't you want to live how you want to live? And not have to worry about adhesives and paste and not eat how you want and have to take things in and out. And no, you can go back and and feel, at least as far as teeth-wise, young again. And that's great.
So denture wearers, there's tens of thousands of them, I'm sure, in your state.
Yes.
It's just tough getting them in.
It's tough getting them in.
The last thing they want to do is go to the dentist because of everything they've been through. Is what you said.
Yeah, they fell out of circulation, right? They went to the dentist, they got their teeth out. They didn't know at that time that there was different options. No one told them, so they may have went to a different office and that was told, well, your teeth are bad and you're going to have to go into a denture. It's not true.
Now, what about the pain part of the procedure? Because that's the scary part, it seems like.
So that's a common question. But I have patients that we do full mouth rehab on, take out all their teeth, completely start over, place implants all around, and they say they have little to no pain the day after. Now, I think that might be a little bit of an exaggeration. I expect a minimal amount of soreness, but even on the average patient, we have very few complaints. And I know that sounds not believable, but I promise it's true.
And you do it right there. So most centers, you go to one place for the surgery, another place where the doctor puts it on top, another place for the imaging, and then you send it out to a lab that makes the teeth. You do it right there. Is that right?
That's what makes us different.
Is that why you do it so quickly?
That's exactly why we do it so quickly. Because we got the training to be able to do everything in-house. So there's a lot of dentists that send it out for the surgery, right? Because they don't know how to do the surgery. Or they'll send it out for the lab that makes the teeth because they don't know how to make the lab. And they'll say, make it work. Or there'll be a miscommunication. The thing that sets us apart is that we do everything in-house. And not only do we everything in-house, my associate and I, Dr. Spencer Russell, have had the training on the surgery and the lab. So I actually teach the lab techs how to do it. And that sounds like, oh, that sounds not that big of a deal, but that's a huge deal because that is the meat and potatoes. That's the engine that drives this. And if that's not done right, it doesn't matter if you did the surgery right. It doesn't matter if you restored them right. It wasn't done right in the middle. And if you don't have that, you can't do it fast and you can't do it right repeatedly.
Okay, so no more dentures. You can wipe them out in the future, possibly?
Yeah, I hope so. That's my goal.